Thank you very much indeed, Jay, and I would like to hand over to our last speaker, Mira Shaker.
Thank you, Stuart. I'm happy to be last, partially because I often am in this situation where I bring gender balance to a rather august panel here. So thank you for that privilege once again. I was going to speak a little bit about the sun, because really everything we are doing for nutrition is under the sun. And not to push the pun too much further, the sun is not a project, it's not a program, it is a movement. It really is a movement that needs to be nurtured. The sun is rising, despite many dark clouds that we've seen in the recent past. And interestingly so, it is rising particularly quickly in the early riser countries. And I'm going to stop the puns very soon when I say I hope the early riser countries will make hay while the sun shines. That's a borrowed pun. I will focus primarily on one issue, which is again a sunrise issue, which is multisectorality. I think nobody in this room needs to be convinced about the fact that we need to work across sectors. Everybody believes in it. But as Lauren said earlier today, how much evidence have we seen that multisectoral projects work? Very little. How much evidence have we seen that actions in other sectors can deliver results for nutrition? And I really want to focus on the issue of results, because that's the title of this session. I picked up 3 key words from the title: prioritizing, scaling up, and outcomes. And I really will speak to these 3 particular words. They're, I think, very important words. So multisectorality, we all believe in it. Yet we haven't seen very much evidence that we can deliver. It may be because we don't know how to do it. It may be because I sometimes call it a faith-based following in multisectorality. I think there's a lot of faith in this room and elsewhere around this issue. Faith is a very good thing, and we heard David Beckman speak earlier today. But with faith, we also heard Michael Anderson speak about evidence. I think a movement is powerful when it can be bolstered by a combination of faith and evidence. And that's how we hope that the sun movement will move, the combination of faith and evidence. Faith-based evidence, that's correct. I hope that we will prioritize on the basis of evidence of what works, because ultimately we are responsible for outcomes and results, but also that we can scale up, at least in the shorter term, those interventions for which we have delivery systems. We can't aspire to scale up things where we don't have delivery systems until we've invested some research in the delivery systems. So that's something we want to be thinking about. The evidence review, the systematic review that Lawrence spoke about, it really is the first time that such a review has been done. But if I may push on that a little bit, I think the review is great, but it stops at saying there's no evidence. There's very little evidence, essentially, that actions in agriculture can have an impact on nutrition. That's the take-home message. And that can be a little bit pessimistic, especially for this enthusiastic group, and we don't want to go away with that message. So we've actually been working a little bit, pushing hard on that with a lot of guidance from Per Pinstrup-Andersen, who I see sitting in the back over here. We are trying to develop what we call, we're trying to push it further and say, if we could really actually plan programs and projects so that we explicitly include nutrition objectives right from the beginning when these projects are being designed, then that's the way we will get impact. In the last financial year, the World Bank invested approximately $4 billion in agriculture and food security investments. We invested approximately $9 billion in social safety, social protection programs, much of it for social safety nets. The opportunity to make a difference through all of these is huge in terms of scaling up and achieving results, but it can only be done if we can push this a little bit more and provide guidance to our teams on what should be done based on evidence and how to do it. The how-to is extremely, extremely important. I know I'm running out of time, so let me emphasize just a couple of other very quick points. As we are developing these guidance notes, we are realizing that it's not such an easy thing to do. First, as has been referred to in many of these conversations over the last day and a half, you can include nutritional considerations, but it's often a trade-off, sometimes with economic considerations. Lots of people know we want to invest in women's participation in agriculture, but what does that do from a nutrition perspective? It takes women's time away from childcare. What impact will it have on nutrition? Potentially some negative unintended consequences there. Similarly, everybody here in this room knows better than I why we should be investing in smallholder farmers and smallholder farms from a nutrition perspective. But from an economic perspective, and correct me if I speak wrong, from an economic perspective, you want to be investing much more in the larger farm holders because that's where you get the quicker bang for your economic buck. Similarly, if you go on and on, I mean, there are many such for which you can, for which you have to make trade-offs. I learned this morning that there are trade-offs between investing in big fish and small fish as well. So there are trade-offs everywhere, and those trade-offs are not easy trade-offs to make. I think we're in a situation where we're all convinced that that it is possible to do it, but it's not going to be an easy thing to do. And I think at the very least, we should focus on a do no harm principle, but we would hopefully go beyond that and focus on maximizing nutrition outcomes. I'm going to make two other very quick points. First, to say that as we think about these sorts of trade-offs, we are starting to experiment and go into some unknown territories. Working with the Ministry of Finance in Canada, we're trying to develop some innovative advanced market commitment type of pull mechanisms for nutrition and agriculture. And the push is, again, to bring those things together. We don't have very many ideas. If anybody has ideas, please share them with us. We're struggling with what ideas to put forward there. And last, I want to say, as we take this work forward, we have very high expectations to live up to from our president. And I'm going to read one sentence from President Zelik's New Year's message to all of us. He said, "In 2011, I hope we can gain more momentum in the fusion of our work on nutrition with food security." Thank you.
Thank you. Thank you very much, Mira. We have actually around 15 minutes for discussion. You've heard about 11 to 12 presentations over the last hour and a half. We have time for discussion. What I would like to do is take blocks of 3 questions at a time. So if you can say who you are, who the question is addressed to, or if it's a general question, and we'll take 3 starting from now. Please put your hand up if you need a microphone. We don't have any hands up. Yes, there's 2 at the back there.
Thank you. Thank you very much. My name is Charlotte Dufour from the FAO Nutrition Division. Apologize for my voice. It doesn't sound like this usually. My question is actually to several of the panel members, but maybe Lawrence more particularly. Well, you mentioned the importance of training, and I think one element of training we often forget is below the undergraduate level is at the diploma level. And we've been talking about what we need to do that's new. But I sometimes wonder, have we even done the basics? How many agricultural extension workers have even basic notions of nutrition? Why don't we start there? And we've been talking about delivery mechanisms. In so many countries, the extension systems are weak, they're understaffed, they don't have the resources. Is there not a need to be creative there to find new methods of extension which integrate nutrition? Thank you.
Thank you, Charlotte. The person next to you, please.
Hello, my name is Ina Schoenberg. I'm with the Federation of the Red Cross based in Geneva. I just have a very quick, perhaps, clarification question for Mira. I think that there's a lot of people in the audience who might take issue with the statement that holistic programming doesn't work. But I think perhaps what you mean is it doesn't work when you're trying to have impacts at scale. The Red Cross is certainly very interested in the well-being of communities and households, and certainly to have impacts at the household level, you need the pieces to come together, and I think most of the people in the room recognize that. I think the big challenge with what we've done with holistic programming is that it's often carried out by NGOs or even organizations like the Red Cross, but at much smaller scale than it needs to, and so I just wanted to perhaps ask for that clarification.
Thank you. There is a gentleman here in the center, please.
I just want to bring some issues on capacity building, especially institutional capacity building when we talk this kind of very complex and multisectoral, and which require a lot of coordination on understanding. And I think we need to have the institutional capacity of in the receiving countries, not only for the evaluation or this thing, but from the very beginning, like operational guidelines of how this kind of multisectoral programs can be implemented, and the training of the field workers, and monitoring, evaluation, and all, and also how the research knowledge of whatever we have can be disseminated to the local level, policy, not only policymakers, but also the researchers, so that they can understand the implications of this kind of the different kind of coordinated program that we are talking about. Thank you.
Thank you very much. Actually, I think we'll quickly go to the panel. There was some comments and questions, one query to you on the holistic program. Mira, maybe take that.
Sure, thank you. Just to clarify, maybe in my shorthand I didn't communicate clearly. I don't mean that holistic programming doesn't work. What I mean is that there have in the past been large-scale, exactly as you were saying, multi-sectoral projects that were conceived. Implementation of those was a major challenge. As we know, in countries, finances, monies, staffing, everything is allocated by sectors. And so the ability of the public sector to deliver at scale is essentially at the sectoral level. I always say that we can think multisectorally. My mantra is really think multisectorally, but implement or act sectorally, sector by sector by sector. And yes, you're absolutely right. It is possible to do multisectoral projects in a small NGO scale, but when you go to a large scale, you really run up against this issue. And perhaps I'll also comment on the capacity building comment, because this also relates to this multisectoral sectorality issue. I think, again, capacities in countries, again, I'm speaking public sector and I'm speaking within the ministries, it's usually sectoral capacity. So Ministry of Health knows what to do about health. Ministry of Agriculture knows what to do about agriculture. There is no cross-sectoral capacity, and I think there's been a lot of conversation about that. The countries where they have actually been able to implement cross-sectoral programs with is where some capacity has been built across these multi-sectoral platforms. And I think I don't know how many people heard from Senegal the other day, but I think the case study from Senegal is really worth looking at, how that multi-sectoral capacity was built in the Prime Minister's office. And I've gone there and seen that in action. It's fabulous. It works. Thank you.
Thanks, Stuart. On the, I'm really glad that Jay raised the whole civil society demand side of things, and that I think that links to the capacity development and training side of things, because when you think about things that can be scaled, yes, delivery systems have to be there, and I think there needs to be this kind of direct top-down sort of stuff. That's important. It doesn't always have to be top-down either. It's important. But I think some of the things you really need to scale are the capacity to be accountable. We need to scale that. Civil society, we need to give civil society more ammunition to say to policymakers and decision makers, what are you doing? Why aren't you spending enough money or time or policy energy on nutrition, on agriculture, and getting them together? But we also need to scale the capacity to respond, and I think that's where the extension agents and the training comes in. I just want to make two quick comments on Mira's presentation, which I thought was excellent. I'm not anti-agriculture having an impact on nutrition. I'm a believer. I just can't convince the skeptics at the moment with the evidence that's out there. And the other thing, big farms, small farms, it depends on the context. It depends on what you're trying to maximize. Per said this morning, if you're trying to maximize piles of food, probably big farms is the best thing to do. If you're trying to reduce food insecurity and malnutrition, it's probably not. Trade-offs.